Welcome. I'm Cheryl Mitchell, the president of Trelevin, a retreat and learning center that's located on a sheep farm here in Addison County. And our mission is really to explore the areas where spirit, nature, and social justice come together. And because of that, it's been my great pleasure to be working in partnership with Growing Bright Futures and Let's Grow Kids to really explore the ways our community supports families with young children. We think it's so critically important. And today, I'm thrilled to have as our guest Beth Diamond, who is the Regional Resource Specialist for 211, who's going to tell us both about 211 and Let's Help Me Grow. Thank you. Welcome, Beth. Thanks so much for being here.
It's so good to be here.
I'm thrilled that you're here. And I'm thinking maybe before we move into Help Me Grow, it might be helpful to, you've been with 211 for 10 years now, right?
10
years.
It's just flown right by.
Do you want to talk a little bit about the original goals of 211 and then we can move more specifically into Help Me Grow?
Well, the original goals of 211 are the same goals we have now, which is to be a 24-hour helpline. We are going to do information and referrals to health, community, government, and human services.
What? 24 hours now.
It's 24 hours. Originally, yeah, I mean, our plan was always to eventually be 24 hours, but we've been 24 hours for a long, long time now. It's just in the very, very beginning. Our rack card has gone through a zillion reiterations.
Yeah. So what kinds of resources can you help people to find?
Sure. It's a long, long list, and we have over thousands and thousands of resources in the database. And it's not just phone numbers, it's not just hours, it's detailed information about services, eligibility, and if there's a certain contact person, and a specific link to a specific web page that gives even more detailed information about that service. So we do that. We're a program of the United Ways of Vermont, which is made up of each individual United Way agency within Vermont. And 211's started in Atlanta, Georgia with a United Way.
And then they moved to Vermont, or they're all over the country now?
At this point, over 90% of the country is covered by a 211.
Amazing. Yeah. So can you talk about, you don't actually answer the phones, right? But your job is to let people know about 211 and also to keep up to date with all those agencies that are in your database?
Exactly. We started out with a particular model with 211 that there would be regional resource specialists. And I'm still a regional resource specialist, which means I go out in my territory, which right now is Addison and Rutland counties, and I go to meetings so I can listen to changes that I wouldn't know about.
Right.
If I wasn't going to those meetings. I go to a lot of community meetings. Here I go to the quarterly Hunger Council meetings. I go to Continuum of Care meetings. I go to local emergency planning committee meetings. It's a lot of meetings.
So actually, if anybody wanted to know anything, they could just call you directly, but you probably don't want people to call you directly.
No,
is that
I'm waiting for the agencies who haven't responded to the web survey to call me. I want to save my telephone time for that. So as you said, the other thing that I do is it's my job for the 200 and some odd agencies that I'm responsible for to keep that information as up to date as possible and detailed without being overly wordy.
Yeah. I mean, I was just always impressed because we got to work together when you were first with the Addison County Community Action Group and then when you were with PACT, and just the wealth of information that you have about how this community works is extraordinary. So you were able, even in those meetings, to say to people, hey, were you aware of, or did you know? I feel like you have this amazing function of bringing people together.
Yeah, and of course at the meetings I also talk about whatever's new at 211.
Right. Speaking of which, so let's talk about Help Me Grow.
Okay, so 211 is a comprehensive information and referral service. People can call us about anything. We have information that any Vermonter could use. Where the motor vehicles is in Middlebury. It's not its own building.
So we could find out which of the Wednesdays they're actually going to be there if we call 211.
I hope that's what we can
Okay.
find out. That's the confusing part, isn't it?
Yeah.
Okay. So, yeah, I always say, if you're ever wondering what to do about something, or you wonder if there's such a thing as, or here's a good one, who can I complain to about X? There's not just one organization or entity to make a complaint to.
Yeah.
It's depends on what you're complaining about. And we get a lot of those calls. Now, most of our calls are for emergent needs, housing, food, your basics, your
Yeah.
basic needs. And certainly most of our calls are about that. But people would be really amazed at what we can do. If you've ever tried to look up a government organization in the phone book, you can't do
Impossible,
it. It's
right,
impossible. And then, a lot of people don't use phone books, so they Google it. Well, I've Googled things that are totally obsolete, and that comes up first in your search. So it's so easy to call us.
So 211 is the place to start for
It's
most
the-
questions,
yes.
isn't it?
It's the place to get help if you need help or just information.
And it's a free call or not?
It's a local call from a landline. Now that we are all using cell phones, you're still going to use your minutes just like any other call.
I see. Okay.
But if you can get to a landline,
If
it's
you
a
can get to a
local call.
landline, it's a local call.
Yes.
Right.
So we are a comprehensive information and referral service, and now we have taken on a portion of the Help Me Grow initiative, and so we are now a specialized information and referral service for children birth through 8.
Which means, do you have new staff? Are
We
they specially
do.
trained?
We
Can
do.
you tell us?
We do. I'm so
about them?
thrilled. I
Yeah.
can't tell you how thrilled I am with our new staff. They are 2 child development specialists, and I'm just going to tell you a little bit about them. Elizabeth has 21 years experience providing care coordination to families and individuals with mental health and substance abuse issues. And she was a social worker for the Vermont Chronic Care Initiative at the Vermont Department of Health Access. And she also, in that role, was working with Medicaid recipients with the highest medical and socioeconomical need. So,
So you're actually going to get to talk to her
yes,
when you call?
you're going to talk to Elizabeth, or you're going
Or-
to talk to Anne.
Okay.
And Anne has a master's in clinical psychology, specializing in children's mental health and emotional development. And she spent the past 7 years working within the public school system in direct care. She worked with students pre-K through the 8th grade, but with a focus on the triple E. And she also spent several years working at the Northeastern Family Institute in their long-term intensive residential program.
Wow. So it sounds like both of them have access not just to, can you give me the names of local child care programs, or I'm looking for a pediatrician, but also they can help you sort out complicated things that are going on with your family.
They certainly have an understanding of those.
They understand it, so they
Yes.
could help you.
Yes. And they're going to have more or less a deeper relationship with callers who agree to be in the Help Me Grow system. They will take calls from anyone who has a child or cares for a child birth to 8. But their specialty is to get parents or caregivers or providers to the right resource for that,
Great.
for whatever the issue is.
Yeah.
But we want everyone who has questions about a child birth to 8 to call 211 and ask for a Help Me Grow specialist. They don't have to be in the system, so to speak.
Yeah.
But if they would like that deeper level of interaction, so that the child development specialists can do follow-ups with the providers as well as with the callers. So it could be a matter of simple questions that they're answering, and just a phone number of a resource.
So this is a little bit more in depth, I think, than what 211 was,
It
because
is-
I think
it is.
people usually were giving out information, and then it was up to you as the caller to make the contact.
Absolutely, except when we felt that the caller couldn't take the next step.
Okay.
We could ask them, would they like us to, patch them in, or
Yeah.
have the agency call them. That's a very rare occurrence, but sometimes someone just can't make the next step.
Mm-hmm.
So we do that.
And with Help Me Grow, you'll offer that routinely, or it's Elizabeth and Ann, is that right?
Elizabeth and Ann.
Okay. They will routinely say to people, do you want some follow-up? Is it okay if I check back to make sure you got what you needed?
Exactly. And then all the information that they get, the data, will be forwarded on to the partner, one of our partners in Help Me Grow.
So
who's
people
going
won't have
do
to
the
go
reports
through a whole set of questions again. If they want to have the information forwarded, they can just say that.
That's not exactly what I
Not
meant.
exactly. Okay.
So if they want to be in that, if they want more intensive sort of just telephone case management, it's not case management. And certainly some of the resources that we're absolutely going to be referring people to are Children's Integrated Services,
Right.
Vermont Family Network, Legal Aid, all sorts of. We have a system in Vermont. We have a very good system in Vermont
Right.
of taking care of children.
Mm-hmm.
And part of that is because of the permanent fund for Vermont's children, because they subsidize a lot of those programs. We have great programs. We're not taking the place of any program.
I said, it sounds a little bit more like everybody had this dream about, not exactly one-stop shopping, but how do people know what's there? And this is a way to really let people know what's there.
Yes. And 211 in general is a place to let you know what's there.
Yeah.
Because you don't have to have a specific question. You could just know what your circumstances are.
Uh-huh.
Most of the time, people know some resources,
Yeah.
but they don't know those. They don't know what they don't know,
Right.
and we're there to help them find what they don't know.
Yeah. Have you thought about this? Have you thought about
Exactly.
that? Kind of thing.
Exactly. So we do some back and forth. The regular 211 call staff, they listen,
Mhm.
they problem solve, but they're not they're not certainly not usually taking anybody's name.
Uh-huh.
But it within the Help Me Grow system,
If people want to give their
if
name, they
if
can.
they want to give their name and their contact information, then it can be a full circle.
Cool.
It's more support,
Yeah, it sounds like more support.
because I can't think of anyone who has anything to do with a child birth to 8 who doesn't have questions.
Certainly the case for me.
I just wish
Yeah.
that 39 years ago I had Help Me Grow to call, because I didn't have a mom, and I had no idea what I was doing.
Yeah. So tell me about it. Did you raise your kids in this community?
I didn't raise my daughter in this community. She came here after I came here, and she was already 18.
Wow.
But my grandchildren were raised and continue to be raised in this community.
Nice.
So they've gone to Mary Hogan School and the middle school, and a couple of them are in the high school. Yeah.
So what's it been like for you as a grandparent of kids in this community? What are you finding is helpful, and what do you wish were in place?
Oh, that's a very interesting question. What's been helpful? Well, I think looking at the whole picture from when they were little, and 3 of them are still little, it's still a Mary Hogan, I felt like the school nurse at Mary Hogan, and
Was
just
that Mary Gill?
Mary Gill,
Mary Gill,
yeah,
okay.
was just a wonderful, wonderful resource for all the kids.
Yeah.
If kids didn't have boots, if kids didn't have hats, if kids didn't have mittens or coats, Mary made it happen. And, also the rest of the staff. I mean, they were just fantastic.
Yeah.
And what was the other part of the question?
Well, I was just, for you as a did you get
As a
direct support as a
grandparent.
grandparent?
Grandparents don't have any legal rights, really.
Really?
They don't. Right now, I happen to be my husband and I are foster parents for one of our grandchildren.
Uh-huh.
And that kind of gives us some rights. But one of the resources that you'll find, if you are a grandparent, one of the resources on the 211 database is Vermont Kin as Parents, which is an organization that helps kinship caregivers find ways to do things.
So that's a new one for me. Is that a new organization?
No, it's not a new organization.
Vermont Kin as Parents.
Vermont Kin as Parents.
Wow.
Yeah.
So that might also apply to aunts or uncles, or
If anyone is giving is the caregiver,
Is the
for a
caregiver.
child,
wow.
whether it's a formal,
Yeah.
like I am for one of my grandchildren, I'm actually a foster parent, or whether it's informal, you can still get information and find out about services.
And we can find out about that by calling 211.
Absolutely.
Okay. And saying,
I'm a
just-
grandparent and I don't know where to turn and I'm taking care of this child. Well, I know I did not have any brothers and I did not have any sons. So when a 17-year-old boy moves into my house,
Wow.
I'm virtually clueless about that.
Yeah.
I mean, I've known 17-year-old boys. When I was 17, I dated some 17-year-old boys, but I didn't have to feed them.
So that was a big shock.
That was a big shock. That was a big shock. But it's okay. It's
Yeah.
great. It's a great opportunity to raise a son,
Yeah.
so to speak.
So I'm guessing that now that 211 is the host for Help Me Grow, you're going to end up really expanding the number of partners that you're working with.
Well,
as well.
we-
And I'm curious how you'll do that and who you'll be talking
Well,
with.
what we are doing is getting input from all the services to let us know where, other services, so that we can add. We've already added. We already added them, a lot of them, to the database.
Wow.
So I want to just talk about the other partners. I don't want to leave the other
Yeah,
partners
that would be
out
great
because
to
we're
hear
just
about.
we're just one of four legs to the stool, so to
Uh-huh.
speak. So we're the centralized access point for Help Me Grow, and Building Bright Futures, and here in Addison County, Dana
Anderson, yeah.
Anderson is the coordinator.
Our show's producer.
And our show's producer today. They are doing, they're promoting the use of Help Me Grow.
Yeah.
The resource specialists are attending the regional council meetings on a regular basis of Building Bright Futures.
So would that be somebody like Amethyst, or who are the resource specialists?
No, I mean the 211
Oh, the
resource
211
specialists,
resource
yeah.
specialists. Okay.
And Amethyst is certainly one of the people who is at
Right.
those meetings.
Yeah.
And the health department is a big piece. The health department is a big piece of Help Me Grow, and also the Vermont Child Health Improvement Program, VCHIP.
Yeah.
They're actually kind of playing a dual role. They have you had them on your show? at
No, we
all?
haven't. So that might be a great idea.
Yes.
Maybe Sarah or somebody.
Yeah, so they train child care providers,
Right.
and
So
they're
they're training providers to administer Ages and Stages, a screening tool. I think.
Yes, the screening tool, and in development is a registry,
Right.
is a screening registry, which has not been in existence before, and then there's going to be data collection and analysis. That's a whole other piece.
Right.
So we're providing the data from our calls, but there's other data coming in from different directions, and that's part of that will be VCHIP and other organizations. So
I'm just remembering when 211 first started, you were using data from calls like people looking for housing or looking for meal sites as a way to help inform policy changes.
well,
And
we have a huge list of people, both in government, average citizens, people from agencies, that are on our listserv for our monthly report. And our monthly report contains a link always to a monthly newsletter, I'm sorry,
Yeah, yeah.
contains a link to our monthly report.
Right.
So if anybody wants to get on that list and see what the statistics are, we don't have a direct system for giving out the information about calls to help me grow. We just had our soft launch September 1st and our hard launch on October 1st. And still coming up later this month is going to be the governor's announcement of the program. So there's not a lot of data yet.
Yeah.
Yes.
But there will be eventually, probably.
Absolutely. There will. That it's still growing. It's still changing.
Yeah.
It's still evolving.
Cool.
So yeah, it's really exciting.
very
So if
exciting
they
time.
want to get on that listserv, they can email info@vermont211.org, and that's
Okay.
Vermont spelled out.
And I believe that your contact information and the 211 contact information will show up at the end of the
At
show.
the end
so
of the program,
people can
we'll get that.
write it down if they
Absolutely.
didn't hear
Absolutely.
it. Just
We're
now.
really, really excited about this.
Yeah.
About this initiative.
So do you think that this is going to be a sort of a first specialized part of 211, and then you're going to have an elder care specialty with specialized resource folks, or what direction are you going?
The senior
The senior
helpline
helpline.
already is the specialized information and referral.
So
for-
211 refers to the senior helpline.
Absolutely,
Okay.
absolutely. In fact, if the caller is 60 or older,
Yeah.
it should be one of the resources.
I've
that
found
we-
it. My folks are quite elderly, both of them.
Yeah, I know your
And we
folks.
found
I
it-
know
yeah,
both your folks.
Yeah, so we
That's
found
what I
it
love about
amazingly
Vermont.
helpful. Yeah. And I'm wondering about housing too. Is there a specialized place that you send people for housing
Well,
questions?
211 has a contract with the Agency of Human Services Emergency After Hours Housing. So we take those
You take those
emergency calls
Okay.
and after hours
Yeah.
during the regular course of the workday, 7:30 to 7:45 to 4:30. The economic services offices take those calls. But
Great.
after hours, we do. And we have access to the same information they do.
Yeah.
So we're not going to be housing someone who wouldn't be housed by them, because we can look it up by the person. Now, in that case, we do have to take names, because we have to look to see if a person's eligible
Right.
for emergency housing. And, we're involved in a lot of things. Our director, Mary Ellen Mendel, is involved in many
Who was our
organizations.
United Way director
Yes,
initially,
she
right? We
was.
were all
Yes,
thrilled
she
when she
was.
took on 211.
And that's how I met her. So I know her longer than 10 years.
Yeah. So this is totally, it's not exactly totally unrelated, but for many years you and your husband Craig did holiday meals, community holiday meals, and I'm curious if those are still happening or if the community suppers have kind of taken over the need for that.
I don't think anything took over the need for that, but after, I think, 16 years of us doing it, there were many attempts on our part to hand that baton over to someone else.
Yeah.
And someone said they were going to do it, and then they didn't. And finally, we just, we couldn't do it anymore.
Yeah. Well, I just want to thank you as a community member to say, that was such
That was the Thanksgiving dinner. We
Yeah.
love doing that. We just love doing that.
I just feel like you've given so much back to this community, both professionally through all the work that you've done, but also
Well, thank
you have a
you.
lot of volunteer community.
And it's
engagement here.
kind of upsetting to me that I can't do that volunteering anymore, because my hours with 211 are very varied. Sometimes I have evening meetings. I never know when I'll have to drive to Bennington.
Yeah.
Or even just to Rutland. I have several regularly scheduled evening meetings that I go to. So I've had to give up being a reading mentor with Everybody Wins. I had to give up volunteering at Project Independence. Yeah, there's lots of things I had, and
there's
court diversion.
So much that you're giving back. So.
Yeah, and let's see, what else was there? Oh yeah, Women's Safe, 5 years on the helpline.
Yeah.
The hotline. So I love doing that, and those volunteer opportunities that I took advantage of were the perfect segue into this job.
Into that, right.
Yeah.
So
in
you
the-
really knew
Yeah.
the community from doing
I
that
really
volunteer
did.
work.
And it was a great pleasure to learn about Rutland County and Bennington County. I really, but it was easier for me because I knew what was out there. And the database was, when I first started 10 years ago, had all the basics, kind of preloaded.
Yeah.
Before they hired an outreach staff, there was a staff that populated the database with your basic information.
Great. Well, Beth, thank you so much
Are
for
we
coming
done already?
today.
Oh,
I'm sorry, the time always goes so
It
fast.
does.
So.
But I really hope that if anyone has a question about a child
Right.
up through age 8, just call us.
And it's as simple as calling 211. You don't need to know
211.
anything
You
else.
don't have to know
yeah.
anything else. That's right.
Yeah.
Because if a caller is calling about food and they're talking to 211 and they mention they have a child newborn to 8,
Yeah.
they're going to be referred right over to the child development specialist.
Sounds great. It sounds wonderful.
Thank you.
Thank you. And thank you all for watching today. We're so grateful to be working with Middlebury Community Television because they help to get the word out about new exciting things old exciting things like 211, and new exciting things like Help Me Grow. And if you have important information for this community, they're wonderful to work with, so just give them a call. And our gratitude again to Beth. You'll see the contact information for both Beth herself, but also for 211 in just a minute. Thanks for watching us. Hope you'll join us again.